great day, Houston. It is Medical Monday. You never know. Something we mentioned today might be the cure you've been looking for. All right, sometimes you have a health issue and you have no idea what the cause is. When it comes to our first hot topic, you can blame it on Fido. Show of hands. How many of you have dogs? How many of you have dogs? Right? Okay. All right. How many of you don't mind if Sparky jumps in bed and cuddles with you in the middle of the night? Come on, admit it. Yeah. Okay. All right. Now you see the number of hands that went up times 10. Okay. That might not be the only thing you're cuddling up to, though. You might be inviting this parasite into your bed as well. Our panel of doctors will tell us what it is and how we can keep it out of our sheets in Medical Hot Topics. And on our panel today, please welcome chiropractor and sports practitioner Dr. DeRamus, optometrist Dr. Julio Arroyo, and vascular surgeons Dr. Kourosh Keyhani and Dr. Arash Keyhani. And yes, they're related. And yes, they are twins. And Dr. Arroyo, as a eye doctor, I'm seeing double, but this is okay.
Only this time.
Only this time, yeah. Otherwise, we got to make an appointment. Okay, so what I mentioned about whenever we have our pets get into our beds, they carry all kinds of other things, but in particular is a thing called eye mites. So people might wake up with irritated eyes and the whole, now Fido's getting kicked out of bed, isn't he? Right? And so those are things to be aware of.
Yeah, and this has become popular, Deborah. Good morning, everyone. It's been recent that we started to understand that folks that have a chronic irritation or inflammation of the surface of the eyelids is actually related to a little spider, or an arachnid, that is called Demodex. And so these little guys are stuck to the eyelashes. So you pull one, you put them in the microscope, you don't see anything, but all of a sudden you see these little creepy things. Ooh. They live around, they have a life of 15 days or so, and they can go about 7 days without food at all. And they are very active at night, and that's the time when they go hunting their females, so the females can hatch the eggs and, continue the process and the cycle. So the thing is that it's really hard to kill. It's not like you can put an antibiotic in there and make it disappear. You actually have to follow a protocol where you exfoliate the area and then you have to use special oil and whatnot. So it's very common. So when you see folks that have the nose that is very red, or even these areas around here, many times they not only have it in the eyelids, but also around here. So I have a lot of patients, you put that oil, and all of a sudden they thought they had red faces, but they didn't. All they had a bunch of bugs in there. So
a bunch of bugs in their eyes. Okay, well, so kick the pet out, or I guess, and wash the sheets, right?
Well, definitely. I mean, the pets are one of the problem, but many times you don't even have to be in contact with the pet. You will have it. We see that a lot more common in individuals that are older. So almost everybody up to 60 or 70 will have some.
So I got
some people are symptomatic, some people are not. Yeah. So. Yeah, but anyway, that's the story.
Yeah.
And
right, so happens that irritation hard with your eyes. Try to go in and see.
Yeah, and the only way to do it is to go to the eye doctor. They pull a few eyelashes. They're going to put it on the microscope, and then it may freak you out because you will see a few crawling around.
Okay, don't show me. Just give me a prescription. Okay, robotic surgery. We've seen more and more of this happen, but the latest thing is this: Star recently performed a soft tissue surgery on a pig, and of course, pigs are those things that are kind of like us, but not really like us. That's why you see so many different things medically happening with pigs. Of course, if you look at the way I eat, it could be a lot more related than, but they stitched together a pig's bowel, and they say it could help eliminate human error in surgeries, but not meant to replace surgeons. But all of you have seen where robotic surgery has been introduced in some field or another.
You know, we do. I mean, we use robotics all the time nowadays. It's fairly common to see it during heart surgeries, gastric bypass surgeries, and so forth. And I think it's a great asset, it's a great tool. It's still not going to replace the physician component. Remember, most of us that go through medical school through training, we get trained to look for the outliers. So what the robot is doing is just helping us do the routine stuff. But we're still, as you know, someone that uses their hands all the time, we're looking for the outliers of stuff that is going to be more of your understanding, more of your experience to tell you that you shouldn't be operating here or doing something on this side of the body, for example. And that's where the robotic is not going to have that capability. But to your point, which you had mentioned, the robotic is going to allow for some finer details that maybe the hands are not able to do.
Yeah,
and so it reduces, one of the best things with the robotic is it improves outcome
And also, the patient recovery is dramatic. It's a big difference between what we used to do with surgery, with big open surgeries, and now doing a lot of things with a robotic or robotic assisted.
And
I think
almost a little pinhole.
tiny keyhole incisions, basically. And so, with the addition of the STAR process, what it's going to do is it's going to give you the additional tools you need, or having an extra set of tools and hands in the OR to assist you with the surgery. So it's not going to replace the surgeon, even though some people are starting to kind of push for that. It's really not going to replace the surgeon. What it's going to do is it's going to give you the set of eyes and hands that you need to assist and do the surgery.
Too. The Da Vinci, for example, is a perfect example of that. But yeah, I can't replace the surgeon because I like to talk to my surgeon. And talking to a robot is just not going to do the same thing there. All right, this next thing here, I think every doctor across the board, no matter what your specific area of practice is, agrees with this, that people need to be healthier, and food is thy medicine, right?
Yes, absolutely.
All right, so the FDA is reevaluating healthy and natural food labels, because we'll see on certain things they'll say, oh, this is healthy or this is natural, and I think sometimes people take natural to mean it's have all you want because it's natural. A rattlesnake is natural, but you don't want to cuddle up to it, right? Okay, so there are things like the Kind bars. They're now going to be labeled as healthy and tasty as opposed to just healthy. It represents a more corporate philosophy, they say. But anyway, the point being is that they really want to kind of narrow down what people think they are eating, because a lot of us are confused.
Absolutely. One of the buzz.
Amen out there in the audience. She's like, yes, right.
Yeah. So one of the buzzwords we've heard recently is organic and also gluten-free. So natural is a term that we're still using somewhat loosely. The deal with Kind bars, the reason why they were tagged by the FDA is because they had a high-fat content, but that's not necessarily unnatural in any way. It's actually good for us. As long as we continue to, because most of us want to be healthy, I think we can agree with that. Yeah. But most of us aren't educated enough to be able to choose what's right and what's wrong. And as long as we allow the big food companies who package these foods to tell us what's healthy, we're going to continue to go down the wrong road with this.
Right. Like everything that says gluten-free, you think you can load up on it.
Well, listen,
soda's gluten-free, probably, right?
They've had companies that have actually labeled things as gluten-free that were never contained gluten in the first place.
Yeah.
Right. But the bottom line is that we know what is good for us as long as it grows out of a tree, out of the ground, and follow that path.
Yeah, the more natural it is.
Absolutely.
And I think there's something personally very concerning for me is the fact that, everybody understands. I think there's a very wide consensus that GMO foods are bad for you. Actually, they've been banned already in several countries all over the world, countries like France and Japan and others. The interesting thing, the very alarming thing, is that many of these products, many processed foods, have something called high fructose corn syrup.
Right.
Well, the problem is not only that it's a poison, it's bad for you. It makes things very sweet, tastes really good, but it's really bad for your health. And that's coming from corn. And all the corn in America, or 95% of it, is all GMO. Yeah. So guess what? There's not a law. The FDA is going to do something good. Maybe what they could do is to actually incorporate a law that makes the manufacturers of GMO foods have to put a label in there that this is GMO. Yeah, and then have people choose if they want to buy it or not,
That's the hard part. Now we look at type 2 diabetes, for example. Number one reason for amputations, for blindness, for renal failure. So many different things. It affects every single one of the, what y'all do. And we kind of know better, but we don't necessarily follow the protocol. You say, like, what do you eat? Well, I had a boiled chicken piece this morning, and that was about it, right? And a half a piece of toast, whatever. But at least we can put the information out there and not make it so confusing. I remember several years ago, in the 90s, when we discovered that fat was evil. Right. And they didn't really explain the difference between what we're talking about here. What makes you fat could be evil, but fat in itself, like an avocado, is not bad. But I remember seeing a can of soda, and it said, a non-fat food. Yeah. But it makes fat. Yeah. It didn't tell you that part, right?
And remember when it was butter versus margarine? Oh, margarine is so much better. Yes. And now it's like, oh my God, margarine is so bad. You need to eat butter. So.
Yes. All right, this next one here, we've known this for quite some time, but they're finding even more and more value to berries, right? And it said that there are a lot of benefits from berries. Research shows that it may help fight Alzheimer's, help with weight loss, and then this other one's going to make berries fly off the shelf because it says that it also helps with erectile dysfunction. So just throwing that out there. Lowers inflammation, prevents clogged arteries, and things like that. All right.
This goes back to what we said earlier, things that grow out of the tree, out of the ground, those are natural force. And with erectile dysfunction, we know that berries help everything function better now as a result of that. The bottom line is there are several things contained inside the berries that they're such as rich in antioxidants, flavonoids, all these things that help, like you mentioned, reduce inflammation in the body. Yeah. And now we're calling Alzheimer's type 3 diabetes because of sugar-related problems with that. So, the berries can actually help maintain blood sugar levels too.
And the bottom line, it goes down to this is a nutrient-dense food.
It is.
Your nutrient-dense foods are your vitamins. That's what we're made of. That's what we need to function with. And so, again, food is like medicine.
It has a very strong antioxidant component. So a lot of the inflammation that we see within the arteries that cause, heart disease and vascular disease and ischemic stuff to the brain is from the inflammation that we see within the arteries. So the antioxidant component really helps reduce that inflammation that we see.
I believe you as a cardiovascular surgeon, but I think that berries is one of those foods that actually help generate a lot of nitric oxide as well. Nitric oxide is a gas that creates
that's a buzzword, is the inflammatory process. It helps downregulate that process.
All right, I want to be around y'all at a cocktail party so we can get into the nitty-gritty of some other things. Thank you very much for our roundtable discussion on hot topics. To play sports, so we know a physical is required. We'll explain why chiropractors should also be part of their pediatric care, from treating injuries and, more importantly, helping to avoid them. That's coming up next.